Hi, today we are going to be doing a Med Pass for Miss Erica Track. She needs an IV for normal saline. She's going to get a piggyback of Zofran, Cipro, and then she's going to get an IV of Zofran. So what we're going to do is we're going to check on our patient first, then we're going to go to the med room and come back to her and administer the medication. All right. Hello, my name is Janissa. I'm going to be your nurse today. And what was your name? Erica. Beautiful name, Erica. And can you verify your date of birth for me? Awesome. And do you know where you are today? Yes, yes. And then do you know what date it is today? Perfect. Awesome. So I am just looking here. Oh, you're feeling nauseous? Okay. Well, I definitely see here we have an order for some medication for that, and that's going to be our Zofran. Do you have any allergies? Have you ever taken Zofran before? No allergies, but no? Okay, it's just going to help settle your stomach so you're not so nauseous. All right, and then I see we have IV for normal saline here. That's going to help keep you hydrated from the vomiting you were doing earlier. And then I also see that we have your Cipro. So Cipro is going to be your antibiotic, and that's going to help with the infection you got going on, your UTI, okay? Okay, perfect. So are you okay for right now? I'm going to run to the med room and get those medications for you. You are? Okay. Your call light's right here, so if you need anything, go ahead and press that, okay? All right. Leaving, going to the med room. I'm going to do some hand hygiene, and then I'm going to draw up medications. So let's turn on the MAR, and we're going to verify the 5 rights. So you've got your medication, your route, your patient, your dose, and the time. And so we've got our normal saline here, right here, and it looks like she's at 125 milliliters an hour. And then we're going to be going to the Cipro, which is 400 milligrams every 12 hours stat. So we're going to be doing that now as well. And then for her ondansetron, we have right here, and it looks like for this one it is 2 milligrams per milliliter. The order calls for 4 milligrams, so we're going to drop 2 milliliters. So to get started with that, we are going to put on our blunt. Normally I would have put air into the vial first, but this vial's been used, so it already has air. But she's getting a little pesky, so we're gonna do it, and then we'll set that down so we don't get a needle stick. Bring it back up, put that air back in, and pull it back to the tube, looking for any bubbles, making sure we get those out of there. Past the tube, get that bubbles, and perfect. We have 2 milliliters right there. We're going to do the scoop method. Get that cap back on there, keep it safe. Scoop method. For some reason these caps don't like to stick very well, but now that we have that in there, we are going to write out our medication labels. This is Zofran. It's got the amount, it's got the dose, it's got the date and the name of the patient. Let's put that onto our medication here. And then we're going to bring this with us so we can scan it into the MAR. And everything looks good. We also are going to go to the equipment room and grab some tubing. So we have our tubing. We have one for our primary IV, and we have one for our piggyback IV. We also need our sterile alcohol, and I have a pocket full of flushes here so we can get that all set up as well. Perfect. Okay. Now, cap, scoop, and click. Okay. Now we go back. All right. Hello, Miss Erica. I am back with your medications. You still doing okay? Yeah, you're still feeling nauseous. So the first thing I want to do is I want to make sure that your IV is clean, and we're going to scan in these medications, okay? So I'm going to scan your bar here. And can you verify your name and date of birth for me one more time? Awesome. All right. So getting the Cipro in there, getting the saline, beep, and getting the, let's see here, Cipro matches. Okay, we're good. Ondansetron matches. Okay, good. And the normal saline matches. Okay, we're verifying the 5 routes again in the bedroom, in their client's room. Okay, and so I'm going to do hand hygiene. I'm gonna don some gloves here really quick. We're gonna make sure that the IV is still patent, that it can still get the medication to you properly, okay? Okay, my dear. Let's get this IV nice and clean. Actually, just to save my back a little bit, we're gonna raise that bed. Makes my life a little bit easier when I'm doing this for you. I know. They don't want it to go too fast. It's not gonna be a fun little ride for you. Okay, there we go. And let's clean this 30 seconds about, yep. And then make sure it dries for about 5 seconds after you've cleaned it for 30. And then my salines are in my pocket. And we're going to get that. Make sure there's no bubbles. Okay. And so we're gonna push a little bit in, make sure that there's no occlusions. Everything looks good. I'm gonna pull back a little bit. We're getting some good return here. Okay, everything looks good. There's no redness, no swelling. All right, so that is good there. Set that down. Keep this elevated. What I'm gonna do now is I am going to give you your anti-nausea medication, your Zofran, just to make sure that we're not getting sick while we're doing our IVs, okay? So I need to take this off. And again, we have verified our 5 routes: right patient, right medication, right route, right dose, right time. And that in there. And then slowly push that through. There we go. Take that off. And then we're going to, I'm gonna get a fresh saline. And we're gonna do about 5 milliliters. Make sure that gets out of that IV and into your body, okay? Those bubbles out of there, perfect. And okay. And pressure lock, perfect. There we go. All right, the next thing I'm gonna do is prep your IV bag, okay? Well, that sits and gets you, actually, let's puncture this first. Oh goodness. Made a mistake in grabbing both, so now they're a little bit tangled. Okay. Perfect. I'm gonna stab the bag. And then making sure that all of my clamps are clamped so we don't get a rush when we hang this up. There we go. Perfect. Okay. And then, don't want that. Can't be having knots in our IVs. That tube we don't need, so that's okay for it to fall. And then we're going to prime the line. So I'm going to release this. There we go. Take the cap off. Make sure that we got some flow.
Is there not another arm that's not? Well, it's still worse.
Yep. And there's our drip.
But it can be
perfect. I'm gonna make sure we have a half here. All right, now we get to program this thing. So options on. It's broken, so we're gonna pretend like we're programming. So do what we need to program. We need to verify with the MAR what the drip rate is, and it looks like our drip rate for our normal saline is going to be 125 milliliters per hour. So we're going to type in 125 milliliters. And then you would want to put in the volume. So we're going to use 1,000 milliliters of volume. And then now we get to close correctly. And then it shuts. All right, and normally what we would do is we would hit start. It would calculate. You would look for 3 drips, making sure that everything's going down. Before you do that, you would hook it into the patient, and we are going to, just because we let that sit on the bed for a second, we're going to re-clean. 30 seconds, 5 minute, 5 second dry, 4, 5, and then add that in. Then we would hit start. After we make sure that all of our leads are open, there's nothing clamped in the wrong spot, everything looks good. We watch for those 3 drips, let it go through, looking for any swelling, changes, pain, everything looks good, awesome. Now we're gonna go to our Cipro, which is we're gonna hit piggyback. So what we need to do that is first lower our primary. And then obviously verify the drip rate, make sure that we're gonna be programming it correctly because it's gonna go in here as a piggyback secondary. And this one, it looks like we're gonna be doing 400 milligrams over 1 hour. 200 milliliters, 400 milligrams in 200 milliliters of 5% dextrose over 1 hour. So now that we have our drip rate, we're going to be puncturing the bag and priming our line. Making sure that our clamp is closed because we don't want to waste any of the medication. Speaking of, did it anyway. Hang this above our primary. And then to prime the line, you just want to gently roll back, and you see that 1 drip there, perfect. Gonna undo this. We're going to sanitize the spot above the pump. 30 seconds, 5 second dry. On, unclamp. Make sure there's no occlusions, no bubbles. We primed our line, everything looks good there. Everything's flowing nicely. How are you feeling? Good? Okay, so while we're waiting for everything to kind of go through her system, we are gonna sit here and we're gonna chart and document all of our findings. All right, so now that that's charted, how are you feeling? Still doing good? Perfect. Okay, I'm gonna lower the bed here, get you to a comfortable place. All right, and then there's your call light. I'm going to do hand hygiene. And if you need us, press that call light, okay, Erica? Okay, perfect.